whole biopsy and so on, and discovered that she had celiac, and took her off of wheat, and she was no longer schizophrenic. Now, that's actually more commonplace than not if people are paying attention to that issue. Of course, nobody's going to catch it, and years of tragedy are going to go by and that person's going to remain psychotic their whole lives if they don't really correct that underlying problem, which is terrible to say, but it's going on a regular basis. Whereas if you do the testing, now it's not to say that everybody who's psychotic is suffering from gluten sensitivity, but it is a key point that they should be considered and examined for that. And I can tell you, it very frequently is not asked about. And so I have a great busy practice because all I'm doing is asking the number 2 question on a regular basis. That opens the door.
Yeah, I agree with you. I mean, most doctors are kind of in the dark about food. I mean, if we think about it, most drugs come from plant-derived sources or some type of chemical composed from food that's just ultra-concentrated to have a certain effect. And if we just look at food as a potential drug and open that mindset, we can take leaps and bounds, I think, into diagnosing patients who have potential food intolerances and food allergies.
Yeah, and I think food is by far the most frequent, but then you can go over into, the phthalates and the colors, the blue dyes. I had a woman come in who was really very cute, elderly woman. We did an ELISA act with her. We used several laboratories. This particular person was another ELISA act person, and it was really funny, she had blue hair. She was in a retirement home. She was great energy, just a delightful woman, kind of to-the-wall, funny and strong human being, but really depressed and crippled by actually the neurologic impairment that sounded like it was downstream from gluten sensitivity. And yeah, she did have a gluten sensitivity, and there are numerous neurologic impairments that can occur with gluten sensitivity, but we also found, interestingly enough, that she was allergic to blue dye because you can actually test for it with the ELISA act. And she had blue hair, and she loved the blue Gatorade. And it was really kind of cute because and she was able to be joked about the whole thing. You got the blue hair, you got the blue Gatorade, and you're allergic to the blue dye. And getting her off of that really, she got a big kick out of it. She could see that made a difference for her.
It's good that her attitude was positive. I get some patients, and I'm sure you have the same experience, where their whole life seems like is destroyed because of a food allergy or an intolerance, and so there's just a mental breakdown that sometimes occurs.
That does happen. I mean, yeah, Peter, that happens to me all the time. And I just as you do, I'm sure, we just work with them and say, look, one of the reasons that you're that way is because you're addicted to it. I mean, the evidence is there on wheat and on milk for sure that the downstream opiate connections really create an addiction problem. I had a guy, this is many years ago now, it's back in the soon after I got into all this back in around 2004, something like that, patient from Ohio. And he was refractory and wouldn't come around with the meds, and we were looking at in other words, the meds didn't work right. We looked at his brain. His brain had a diffuse cortical hypoperfusion, which is characteristic often of an immune system dysregulation. Is what happens. It looks like, if you look at the brain, it looks like somebody just hit the brain with a ball-peen hammer all over the surface of the brain. So instead of having a smooth surface, it's beat up, but it's diffuse. It isn't localized in certain areas. So anyway, and we went through the whole thing, and we at that time I didn't know that much about immune dysregulation and testing and so on. But I said, I really do think this is part of the problem. And he went off of the wheat, and he had a very, very significant withdrawal period that was difficult. At that point, I didn't have an idea of what to do with it, but he had a significant withdrawal period, and it was months because he just, we didn't at that point, being fresh into it, I really didn't know how to support the system. And that then aggravates, of course, the withdrawal because he wasn't actually healing, and he was kind of raw on the inside for a longer period of time than he should have been. But that withdrawal thing is a significant complication, and when they see the withdrawal, and you know this very well because you do this all the time, they see the withdrawal or they see the problem that occurs going off of it. The good news is if they actually go off of it and they go back on it, they can really see what's been actually going on.
Yeah, I'm thankful for that particular, I guess you could say, blessing of a problem, because oftentimes, like you say, when they get off of it and they try to test the hypothesis, so to say,
yeah,
they have a worse symptom reaction than what they were accustomed to having prior.
Yeah. Well, and I think the other thing that often gets overlooked, I don't know where you are, Peter, with testing for neurotransmitters and so on, but, we use metametrics. We use neuroscience a lot. We use neuroscience even more than metametrics because neuroscience has that whole insurance reimbursement thing going on. And not only do they give good information that are directly related to brain function and neurotransmitters, but, it's reimbursable with a lot of insurance companies. So, I had a guy come in from California this was an interesting referral. A guy was a software engineer, was completely refractory to care, was depressed, wasn't getting better, had been diagnosed as ADD. He lived in Santa Barbara, actually had done a presentation with with Patrick Carnes's group down in Scottsdale. I'm trying to get with the acronyms. ITAP, it's the International Institute for Trauma and Addiction Therapists.
Mm-hmm.
Patrick Carnes is a very interesting guy. He's very interested in brain function and neurotransmitters, and so that was probably, I can't remember when I did that presentation. It was probably like in 2006 or 7, something like that.